Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, Diabetes and Chronic Kidney Disease, What You Should Know, is presented by Dr. Shabnam Gupta. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of the presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for additional dates and times, please call 1-844-472-8499, option 3. And I am now going to turn things over to Dr. Gupta.
Good afternoon. So today we're going to talk about diabetes. So diabetes is a group of diseases that affects your body by the way your body handles sugar. So insulin is produced by your pancreas, and sometimes there's problems in the way your body handles that glucose, and that's leads to diabetes. There are two main kinds of diabetes, type 1 and type 2. So in type 1 diabetes, your pancreas are not making enough insulin, and therefore your body is not getting enough insulin and not able to handle the sugar. That is responsible only for 10% of the total burden of diabetes in the world. Type 2 is responsible for the 90% of the global burden of diabetes. And type 2 diabetes is actually a lifestyle disease. As life has gotten more and more automated and sedentary, incidence of diabetes is rising. Type 2 diabetes is responsible for 90% of the global burden of diabetes. What is chronic kidney disease? Chronic kidney disease is a gradual loss of kidney function over time. So what do our kidneys do? Our kidneys filter the blood and clean the blood, basically removing all the toxins and the waste products, and make urine. So as sugar rises in the blood, the kidneys are not able to do their job efficiently, and over time, kidneys lose function. If diabetes is not managed properly, CKD increases, and as CKD progresses, it causes kidney failure. Who gets diabetes? So as I've said, the prevalence of diabetes is rising in the world. In 2021, there were 537 million people worldwide suffering from diabetes. This number is set to rise to 783 million by 2045. 90% of people with diabetes have type 2 diabetes. The number of people with diabetes has doubled in the last 20 years. And this is mostly because of the epidemic of obesity. The incidence of obesity has tripled in the last 20 years. Diabetes is also increasing in prevalence because of population aging. As we live longer, we have higher chances of getting diabetes. So how are these two things related? How is diabetes and kidney disease related? Like I mentioned, diabetes affects the kidneys by causing high glucose levels in the blood, which damages the nephrons in the kidneys, which are the functional units in the kidneys, and they're not able to perform their function properly, causing to leakage of protein in the urine. Protein leak over time causes damage to the kidney function, and kidney function starts to deteriorate. Prevalence of diabetes is increasing, and hence prevalence of kidney disease is also increasing. About 30% of people with diabetes develop kidney disease. Diabetes is the commonest cause of kidney disease in the world, and unfortunately, 50% of people on dialysis diabetic nephropathy begins. Once again, excess sugar causes damage to the filtration units in the kidney, which are called the nephrons. This cartoon shows the picture of the nephron. And the nephrons are not able to process the sugar properly, causing their membranes to become leaky, and this causes protein leak in the urine. Persistent leakage of protein in the urine damages the functional unit, and slowly the numbers of the nephrons, functioning nephrons, goes down, and that's how the kidney starts to lose its filtration capacity. So diabetes develops slowly in the kidney, and over time, it takes 5 to 10 years where the kidney starts to lose function. Let's go back and talk about the risk factors for diabetes. So we have the modifiable and the non-modifiable risk factors. The non-modifiable ones are age. So risk of diabetes increases as one grows older. So after the age of 45, we have higher incidence of diabetes. Although that is changing lately, younger and younger people are developing diabetes because of our lifestyle. Then there is genetic predisposition to diabetes. So if you have a family history, you are more likely to develop diabetes. And then certain ethnic populations have a higher prevalence of diabetes. Diabetes is highest in South Asians, African Americans, Hispanics, and Pacific Islanders. More importantly, let's talk about the modifiable risk factors. Risk factors for developing diabetes. Central obesity is strongly linked to insulin resistance. So if a diabetic were to lose even 5 to 10% of their body weight, their insulin sensitivity would increase nicely and improve their glycemic control, and so decrease the incidence of kidney disease. Smoking. Nicotine has been shown to increase oxidative stress and chronic inflammation in the body. Smoking is associated with 30 to 40% higher risk of developing diabetes. Alcohol. High intake of alcohol contributes to obesity and fatty liver, which leads to impaired glucose metabolism, which leads to diabetes. So regular physical activity enhances insulin sensitivity. 150 minutes of moderate exercise per week can help increase your insulin sensitivity and improve your glycemic control. Unhealthy diet. So diets low in fruits and fiber, they impair your glucose control. We have some new data showing that sleep disorders can also impair your glucose control. So treatment of sleep apnea, better sleep hygiene can help. Also, psychosocial stress. Chronic stress causes increased cortisol levels, which increases insulin resistance. Research is showing practices of mindfulness and yoga can help mitigate stress and help glucose dysregulation. What are the risk factors for developing CKD in diabetic patients? Poor glycemic control. So if one has diabetes and their sugar is not well controlled, this increases your risk of developing kidney damage. So ideal glucose control is to aim for an A1C of less than 7. If this is not achieved, there is higher sugar filtering to the kidney, which damages the kidney and over time causes kidney damage. High blood pressure, which is very common in diabetics, also causes further damage to the kidney. Higher the blood pressure, higher the filtration pressure in the kidney, which causes increase in the proteinuria, which in turn damages the kidney. Duration of diabetes. So the longer you've had diabetes for, the higher your chances of developing kidney disease. In type 1 diabetes, it usually occurs 5 years after you've had diabetes. But in type 2 diabetes, because there is no actual time when you find out that your glycemic control is impaired, one needs to monitor for kidney damage from the onset of diagnosis. Genetic factors, if there is a family history of diabetic kidney disease, one is more likely to get the same. What are the signs and symptoms of CKD? Unfortunately, early stages of kidney disease, there are no symptoms or signs. The earliest sign of kidney damage is minute amounts of protein leaking into the urine. This is called microalbuminuria. So it is of paramount importance to follow up with your doctor who will be checking for protein leak in the urine, because that is the only sign in the early stages. Later, you may develop swelling in the ankles, shortness of breath, fatigue, elevations in blood pressure. That usually starts to happen around stage 3. Stage 5 CKD is when it's also called end-stage renal disease, where the kidney function is not sufficient to maintain healthy life. And the rise of toxins in the body, the urea levels in the body, causes nausea, vomiting, confusion, shortness of breath, severe fatigue, anemia. How is kidney disease diagnosed? So, like I said, in the early stages, there are no symptoms. The earliest sign of kidney disease minute amounts of albumin in the urine. Then there are blood tests, which will show if your creatinine is rising and your GFR is going down. Your doctor would also like to do an ultrasound of your kidneys to see if there are any blockages to your kidney that might be further causing damage. They would also like to evaluate the size of the kidney and the echo texture of the kidney. With failing kidneys, the echo texture becomes more brittle. what can we do to prevent kidney disease in diabetics? So I'll say it again. Glycemic control is extremely important. Maintaining normal blood glucose levels is essential. So goal for the hemoglobin A1C is around 7. It is hard to do this, but that is the goal. Blood pressure control. For people who have high blood pressure and are not diabetic, the goal for blood pressure is 140/90. But for a diabetic, the goal is lower. Ideal blood pressure should be 130/80 or below. So one has to be compliant with the antihypertensives. And there are great medications like the ACE inhibitors, the ARBs, the MRAs, which have additional benefit in slowing down the progression of CKD, not just blood pressure control. Smoking cessation, like I mentioned before, nicotine causes increased oxidative stress, which causes glycemic dysregulation, and so causes progression of kidney disease. Weight management of paramount importance. If a diabetic can lose 5 to 10% of body weight, the glycemic control improves tremendously and thus helps in slowing down the kidney disease. And once again, regular follow-ups, regular monitoring of the kidney function, the blood glucose, and the blood pressure is very important. What are the treatment options? Fortunately, there's a lot of research going on in diabetic kidney disease, diabetic nephropathy, because of the sheer burden of the morbidity in the world. 20 years ago, we only had the ACE inhibitors and the ARBs as the options for blood pressure control and proteinuria control. But fortunately, we have some other agents now, which are very helpful, like the SGLT2 inhibitors. You might have heard the names Farxiga and Jardiance. They not only improve the sugar control, but they also reduce the inflammation in the kidney and stabilize the kidney function. Another class of agents is the GLP-1 agonists. These are also very important because they help with sugar control, but they also help with weight control. So decreased weight, once again, helps stabilize the kidney function. We also have the non-steroidal mineralocorticoid receptor antagonists. This is relatively new. And this helps in decreasing inflammation in the kidney and reducing proteinuria. So we do have some good options to slow down the kidney decline in the kidney function. But unfortunately, it is still a progressive disease. And then when the kidney function is below 10%, it is just not enough to handle the metabolic needs of the body. And then you have to look into renal replacement therapy or kidney replacement therapy, out of which the best option is a kidney transplant, but not easy to get. So then we have to replace kidney function with dialysis, of which there are two kinds, the hemodialysis and the peritoneal dialysis. So in conclusion, diabetes prevalence is increasing. Type 2 diabetes is a lifestyle modification disease. So that is where we can make a difference. If we improve our lifestyle, improve our diets, increase exercise, manage our weight, we can reduce the incidence of diabetes. And diabetes is a leading cause of chronic kidney disease. Early detection and management of diabetes can slow down the incidence of kidney disease, which can slow down the progression.
We would like to say that we appreciate you joining us today. We kindly ask that you take a few minutes after today's webinar to complete the program survey. The link to the survey has been added to the chat for your convenience. A special thank you to Dr. Gupta for dedicating your time and expertise today. If you have any additional questions or comments, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499, option 3. That concludes today's webinar, and I hope you all have a great day.
Thank you guys for joining.